This video will describe the Emergency Medical Task Force, an exciting concept that is changing the way we approach large-scale events. The governing entity of the subject is the Department of State Health Services, the same entity that oversees your medic certifications as well as many other professions. In the early 90s, after the passage of this Healthcare Act, and in an effort to help rural areas gain access to more health resources, Texas divided into 22 distinct trauma service areas, then identified them alphabetically from the letters A to V. Regional Advisory Councils, or RACs, were then established in each trauma service area. RAC-R, for example, located in the southeast corner of Texas, was formed in May 1993. This union of neighboring counties allowed resources to be combined, providing better capabilities to the citizens. Last year, the Department of State Health Services created yet another level of consolidation, combining numerous RACs, thus creating 8 Emergency Medical Task Force regions in Texas. The EMTF project is part of a much larger statewide public health and medical response system known as the Texas Disaster Medical System, which coordinates numerous agencies from the acute care side and the public health aspect. Once again, the goal is the same, combining the RAC's resources to provide a more coordinated, efficient, and effective response in times of emergencies. Southeast Texas, which is the Emergency Medical Task Force Region 6, consists of 3 RACs, RACs H, R, and Q, and the 25 counties within that area. Each EMTF's goal is to structure and organize 4 components within its region: ambulance strike teams, RN strike teams, ambuses, and a mobile medical unit. The ambulance strike teams consist of teams of 25 ambulances, with an ambulance strike team leader ready for deployment to provide emergency medical capabilities and evacuation assistance in times of emergency. RN strike teams consist of 25 registered nurses who are ready for deployment in times of emergency. These teams will help support hospitals, alternate care sites, or other duties as assigned. The AMBUS component, also known as multi-patient vehicles, are large buses specifically designed for the simultaneous transport of multiple bed-confined or critical patients in times of evacuation. They were recently used in the Bastrop wildfire event as a rehabilitation center for firefighters. The most complex component is the mobile medical unit. This MMU is basically a mobile hospital that can be established on virtually any level ground and become a self-sustained hospital for numerous days. Upon request, strategically placed trailers, trucks, and generators of the MMU will deploy from numerous areas within the RAC to a predetermined location. In about 6 hours, in coordination with administration and command staff, the MMU can begin accepting patients. Keeping in line with the span of control concept described in the NIM structure, 2 new levels have been created: the EMTF coordinator and the task force leader. The EMTF coordinator provides support and management for all aspects of the EMTF program. The EMTF coordinator serves as the primary contact for local offices of emergency management, local emergency response agencies, hospital, local health department, regional DSHS staff, council of governments, and any other partnering agency to provide guidance during the planning, coordination, implementation, and response. The task force leader will be the liaison between the coordinator, located at their headquarters, and the EMTF components operating in the affected area. Utilizing NIMS, the task force leader will direct the focus of the 4 EMTF components to remain within the strategies developed by command. With these 4 components working cooperatively within a predefined structure, you can expect an effective and efficient coordinated response to large-scale emergencies. You can follow these links for more information.